Comprehensive testing with door-to-door screening to detect coronavirus cases in Delhi to begin today. Country's largest COVID care centre in Chhatarpur starts with 2,000 beds at Radha Swami Byas campus. Union Health Minister to chair 17th review meeting on COVID-19 response today. Union Ministers for External Affairs, Civil Aviation likely to attend. Central team to take stock of the disease response in Maharashtra. Due to rising COVID numbers, international passenger flights to remain suspended till July 15th. Jharkhand extends lockdown till 31st of July. Complete lockdown in Guwahati from midnight on Sunday. All schools to remain closed till 31st July in Delhi. Recovery rate in the country is more than 58%. In past 24 hours, close to 14,000 patients discharged. 11 new testing labs operational. Number of active cases close to 1,90,000. Worldwide cases surpassed 97,64,000. Indian Navy inducts DRDO developed Marich, an advanced anti-torpedo decoy system capable of being fired from all frontline warships. Navy received a major boost amid the country's resolve to become Atmanirbhar in niche technology. Washington, D.C. to become 51st state of the United States of America. U.S. House approves statehood in a historic vote. Hello and welcome to this edition of the news. I'm Rukmayana. Top story. In order to adopt a comprehensive policy for Delhi, the government will begin by conducting random serological tests of 20,000 people starting today till the 10th of July. Serological survey will be conducted in all districts of Delhi. For sample testing will be conducted spanning all sections and ages. This will help in comprehensive assessment of the spread of the infection and help draw up a strategy. A sero survey involves testing of blood serum from a group of individuals. It is a community-based sero survey to estimate the prevalence of COVID infections in the population. The survey was started by ICMR during May in collaboration with the Ministry of Health and Family Welfare, National Center for Disease Control, State Health Departments and WHO. An ITBP team has taken over as the nodal agency of the capital's largest COVID care center. Starting from the 26th of June, that's yesterday, the center, which will have a full capacity of 10,200 beds, has been set up in the Radha Swami Byas campus in Chhatarpur area. ITBP DG Surjit Singh Deswal and Southern District Collector BM Mishra, along with several officials, were present when the ITBP took over.
In order to tackle the surging coronavirus cases in Delhi, an experienced team of doctors and administrators from ITBP reached a makeshift COVID care center facility set up by Radha Swami Satsang Byas in Delhi's Chhatarpur area. The team had regular meetings and talks with the officials from Delhi government and district officials. The team subsequently met the ashram management. Delhi Jal Board, Electricity Department and staff members from South Delhi Municipal Corporation were present at the meeting. The facility currently has 2,000 beds. It was jointly inaugurated by ITBP DG Surjit Singh Deswal and South Delhi's District Magistrate BM Mishra. The construction of 10,200 bed facilities is nearly complete. Once done, it would be the largest such facility with over 1,000 physicians.
Ministry of Home Affairs ने ITBP को नोडल एजेंसी बनाया है for patient management and treatment of this complete camp. ITBP को लंबा एक्सपीरियंस है. पहले हमने क्वारंटीन सेंटर बनाया था छावला में. हमारा पिछले 3 महीने से 200 बेड का हॉस्पिटल नोएडा में है, जो सारे के सारे पुलिस फोर्सेस जितने भी एनसीआर में हैं सब के लिए अवेलेबल है. हमारी जो मेडिकल ऑफिसर्स की टीम है, डॉक्टर्स की, नर्सिंग स्टाफ की और पैरामेडिक्स की, वो वेल ट्रेन टीम है और इस कैंप को भी बहुत ही अच्छे तरीके से चलाएंगे ताकि अपने शहर के या देश के नागरिक इस कोरोना के टाइम में अच्छी ट्रीटमेंट प्राप्त करें।
The core reason for deploying ITBP behind the running of this centre lies in their effectiveness in tackling the pandemic. This primary border patrol organisation has been at the forefront of fighting the coronavirus pandemic since the first case came to India. Since then, it has set up various quarantine facilities across the country. Keeping in mind their first-hand experience in tackling the COVID-19 pandemic, the Ministry of Home Affairs has given this responsibility to the ITBP. The team will be assisted by district officials, doctors from Central Armed Police Forces and paramedics.
रिसोर्सेज जो मोबिलाइजेशन है स्टाफ का वो कई चरणों में है। अभी 2000 बेड के लिए आईटीबीपी की मदद से हमारा जो है मेडिक्स पैरामेडिक्स जो है इसमें मोबिलाइज हो रहे हैं, ये हम शुरू कर रहे हैं। जैसे जैसे हम इसको बहुत जल्दी ही विदिन अ वीक और सो हम पूरे 10,000 में स्केल कर लेंगे और वैसी रिक्वायरमेंट फिर विभिन्न एजेंसियों से जैसे भारत सरकार डिसाइड करती है उन एजेंसियों में के तहत जो है ये आगे स्केल होगा और उतने स्टाफ और लाए जाएंगे।
This huge COVID care centre is spread over a large area where doctors, paramedics, security and management will be needed. Several meetings and preparations are still underway given the scale of operations of the facility at full capacity. News 9 Desk, DD India.
The Union Group of Ministers on COVID-19 will hold their 17th meeting today. The meeting, chaired by Union Health Minister Dr. Harshvardhan, will be held at Nirman Bhavan. External Affairs Minister Dr. S. Jaishankar, Civil Aviation Minister Hardeep Singh Puri, Minister of State for Home Affairs Nityanand Rai, besides other union ministers, are expected to attend. The GOM will be briefed about the latest status, response and management of COVID-19 in the country. A brief snapshot will also be presented to the GOM, highlighting the comparative position of India vis-a-vis other countries in similar stage of easing lockdown. It will also discuss further prevention and future course of action with regards to the pandemic. Meanwhile, a central team led by Union Ministry of Health and Family Welfare Joint Secretary Love Agarwal will visit Maharashtra today. The team will interact with state officials and coordinate with them to strengthen ongoing efforts for management of COVID-19. A similar meeting was held yesterday when the team visited Ahmedabad in Gujarat. The central team will also visit Telangana tomorrow. The graded preemptive and proactive steps taken by the government along with states and union territories for prevention, containment and management of COVID-19 are showing encouraging results. Recovered cases have exceeded active cases by 96,173. In the last 24 hours itself, a total of 13,940 patients have been cured, taking the cumulative figure to 2,85,636. This has led to the recovery rate touching 58.24% amongst COVID patients. Presently, there are 1,89,463 active cases. All are under active medical supervision. In the quest to expand COVID-19 testing labs network across the country, ICMR has inducted 11 new labs in the past 24 hours. India now has 1,016 diagnostic labs dedicated to COVID-19. This includes 737 in the government sector, 279 are in the private sector. The number of samples tested every day continues to meanwhile steadily grow. During the past 24 hours, 2,15,446 tests were conducted. The total number of samples tested as on date is 77,76,228. The Maharashtra government informed the Bombay High Court that as of June 26, there are 1,414 inmates above 60 years of age, of whom 425 have comorbidities in prisons across the state. The Maharashtra government also informed the Bombay High Court that inmates with comorbid conditions would have access to rapid diagnostic tests depending on the availability of test kits. The state government made the submissions before the High Court following a clutch of public interest litigations that were filed expressing concern about inmates' health conditions after several prisoners tested COVID positive across Maharashtra's jails. The bench sought information on the health status of convicts and under trials in the prisons, including temporary prisons, information regarding number of beds, total square foot area available per inmate, list of inmates kept in temporary prisons, number of rooms, number of prisoners per room, and number of bathrooms, among others. In the wake of the corona outbreak, the Civil Aviation Regulator, Directorate General of Civil Aviation, has decided to suspend all international flight operations till July 15th. In an order, DGCA said that scheduled commercial passenger services to and from India will remain suspended till 11:59 hours, 23:59 hours of July 15. That is nearly 12 midnight of July 15th. This restriction will not apply to international all-cargo operations and flights especially approved by DGCA. However, international scheduled flights may be allowed on selected routes by competent authority on case-to-case basis. Scheduled international passengers flights were suspended on the 22nd of March. However, passengers have been flying in and out of India on Air India's Vande Bharat mission flights and charters operated by foreign countries. Under the Vande Bharat mission, a special Air India flight for repatriation of stranded Indian nationals left from Paris Charles de Gaulle Airport for Kochi, Kerala. 248 Indians, including 4 infants from Europe, Latin America, Iceland and the Caribbean, are on board the special flight. And that's the tweet by Hardeep Singh Puri, Civil Aviation Minister, who has tweeted, Vande Bharat is without doubt one of the largest evacuation missions of its kind, both in terms of magnitude and geographic reach. Nearly 14,500 Indians have returned on about 725 flights since 6th May 2020 and 50,000 have flown out. 3,816 people have returned from different countries today. And the next phase of Operation Samudra Setu for repatriating Indian nationals is on in full swing. Indian naval ship INS Jalashwa evacuated 687 Indian nationals from Iran and will reach Tuticorin today. Before boarding, medical checkups of all passengers were done. All basic amenities and medical facilities were provided to evacuees during the sea passage. This is the 6th voyage by Indian naval ships as part of Samudra Setu program to bring back Indian nationals from neighboring countries. The Indian Navy has already repatriated 3,992 Indian nationals stranded abroad as part of Operation Samudra Setu. The Jharkhand government has extended the lockdown-related restrictions currently in place in the state till the 31st of July. However, all activities permitted prior to this order will continue. Jharkhand had a total of 2,262 cases. So far, 1,605 of the infected have recovered. The number of active COVID cases in the state stands at 645 and fatalities at 12. In Guwahati, complete lockdown will be imposed from tomorrow midnight for 14 days. Emergency services will be allowed, such as pharmacies and hospitals only, which will remain open. Even essential item shops, fruit and vegetable shops will remain closed. The lockdown will be a stricter one than the earlier. From yesterday evening, curfew has been imposed in Assam from 7 p.m. to 7 a.m. Weekend lockdown in town committees and municipalities will be imposed from today onwards, and villages will be exempted. Critical infrastructure constructions like Ganeshguri flyover and Bagjan will be exempted. Meanwhile, in the wake of increasing number of cases over the past 2 weeks in Navi Mumbai, the municipal commissioner has ordered a complete lockdown in 10 containment zones covering over 71,000 households. The lockdown will be implemented from the 29th of June to the 5th of July. There will be no movement of people going in or out of these zones except for medical emergencies and buying essential goods. Violation of the order by any person will attract action under Disaster Management Act 2005, Section 188 of the Indian Penal Code and other legal provisions. 5,024 new cases of the virus were reported from Navi Mumbai yesterday. There are 65,829 active cases in Maharashtra, with the death toll rising to 7,106.
पूरे मुंबई में लगभग 750 कंटेनमेंट जोन्स हैं, उसमें से लगभग 250-300 कंटेनमेंट जोन फक्त हमारा जो नॉर्थ रीजन में है। करीब 15 दिन पहले थोड़ा सा अलार्म हुआ था कि केसेस में सडनली स्पाइक आया था। उसके बाद यहाँ पे लॉकडाउन को दोबारा एनफोर्स किया गया। 27 हॉटस्पॉट्स आइडेंटिफाई किए गए कंटेनमेंट जोन में से, वहाँ टोटल लॉकडाउन किया गया। बीएमसी के अधिकारियों ने और पुलिस के अधिकारियों ने लोकल वॉलंटियर्स की मदद से बहुत ही स्ट्रिक्ट लॉकडाउन एनफोर्स किया है और उसका रिजल्ट अभी देखने को मिल रहा है। अभी हम चार्ट डिस्कस कर रहे थे, चार्ट ऊपर से अब जो केसेस जो डेली रिपोर्ट हो रहे हैं कम होते जा रहे हैं।
Schools in Delhi will continue to remain closed till the 31st of July in view of the COVID situation. Deputy Chief Minister and Education Minister Manish Sisodia made the announcement after a meeting with officials of the Directorate of Education on how to reopen schools. Anti-submarine warfare capability of the Indian Navy received a major boost with the conclusion of a contract for advanced torpedo decoy system Marich, capable of being fired from all frontline warships. Design and development of this anti-torpedo decoy system has been undertaken indigenously by DRDO labs. Bharat Electronics Limited, a defence PSU, would undertake the production of the system. The prototype, installed on board a nominated naval platform, had successfully completed all user evaluation trials and demonstrated features as per naval staff qualification requirements. The induction not only stands testimony to the joint resolve of the Indian Navy and DRDO towards indigenous development of defence technology, it has also given a major fillip to the government's Make in India initiative and the country's resolve to become Atmanirbhar in niche technology. The Jammu and Kashmir police said it has identified the terrorists behind the attack on a security forces team in Anantnag district yesterday. Police say that the terrorist identified is Zahid Das and belongs to JKIS outfit. One CRPF Jawan was martyred and a minor boy was killed in the attack. The terrorists fired upon a road opening party of the CRPF 90 battalion near Padshahi Bagh bridge in the Bijbehara area of South Kashmir district around 12 noon. The flood situation in Assam further worsened on Friday, with over 2,52,000 people affected in 16 districts of the state, according to the Assam State Disaster Management Authority. After almost continuous rain, one more person died in Dibrugarh, taking the flood toll in the state to 16. So far, 704 villages have been flooded. According to the daily flood bulletin of the State Disaster Management Authority, 18,234 people are taking shelter in 142 relief camps and relief centers. A total of 11,765,027 hectares of cropland has been submerged. And Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program at 11 a.m. tomorrow. This will be the 66th episode of the monthly radio program. It will be broadcast on the entire network of All India Radio and Doordarshan and will also be streamed live on the YouTube channels of AIR, DD News, PMO and INB Ministry. AIR will broadcast the program in regional languages immediately after the Hindi broadcast. The regional language versions will be repeated at 8 in the evening as well. Let's now take a look at the global COVID-19 situation. At the global level, the number of confirmed cases has exceeded 97,64,000 with over 4,92,000 fatalities. The United States continues to lead in cases with more than 24 lakh 62,000, about 1/4 of all infections worldwide. The US is also the world leader in deaths with nearly 1,25,000 succumbing. Brazil is the second most infected with 12,74,000 cases. Russia stands third with 6,19,000 cases. And the United States has set another single-day record for new COVID cases. Amid the surge of new cases in the U.S., the White House Coronavirus Task Force, led by Vice President Mike Pence, held its first briefing in nearly 2 months. Pence said that 16 states were experiencing increase in infections, while 34 states had recently reported stabilizing numbers of new cases. Pence said the federal government was focusing on surges in southern states and encouraged people to comply with local, state and federal guidelines to avert further spread of the virus. Meanwhile, members of the White House Coronavirus Task Force on Friday issued a warning to younger people that they could be posing a risk to the elderly who may be more vulnerable to the virus. It said young people may not be at risk of serious disease, but they could infect someone who is vulnerable. And the World Health Organization has said that it needed more than $30 billion over the next year to develop and produce COVID-19 tests, vaccines and other treatments. Renewing its call on Friday for global collaboration against the pandemic, the WHO said $3.4 billion had been contributed for the coalition so far, leaving a funding gap of $27.9 billion. Of that, $13.7 billion was urgently needed. The WHO is working with a large coalition of drug development, funding and distribution organizations under what it calls the ACT Accelerator Hub. It aims to scale up delivery of 2 billion vaccine doses, including 1 billion to be bought by high and middle income countries by the end of 2021. In Brazil, the number of confirmed cases has increased by 46,860 to 1.2 million within the past 24 hours. The death toll has risen by 990 to 55,961. Within the same period of time, the pandemic has impacted the fragile economy of the country too. Measures taken by authorities to fight COVID-19 like lockdowns have threatened the livelihoods of informal workers and pushed them further into poverty, hunger and homelessness. However, President Jair Bolsonaro has been critical of Brazil's states implementing tough lockdown measures. Brazil has been in lockdown for months and new deaths and infections are increasing daily. In a historic vote yesterday, the House of Representatives approved making Washington, D.C. the country's 51st state. As per the legislation, Washington would be represented by 2 senators and 1 member of Congress. Friday's vote marks the first time a Washington statehood bill has passed in either chamber of Congress. A statehood bill came up for a vote in 1993 but failed in the House.